Good day everyone, I am Sandrine Rodam and today we will be discussing all about dehydration. By definition, dehydration is the absence of a sufficient amount of water in your body. Dehydration occurs when you use or lose more fluid than you can take in, and your body doesn't have enough water and other fluids to carry out its normal functions. This condition becomes serious if the loss is about 10% of the total body water and fatal if loss is from 20% to 22%. It is especially critical in babies. Electrolytes are also lost with the water in this condition, and the skin becomes loose and inelastic. The most common cause of dehydration in young children is severe diarrhea and vomiting. Older adults naturally have a lower volume of water in their bodies and may have conditions or take medications that increase the risk of dehydration. This means that even minor illnesses, such as infections affecting the lungs or bladder, can result in dehydration in older adults. Dehydration also can occur in any age group if you don't drink enough water during hot weather, especially if you are exercising vigorously. You can usually reverse mild to moderate dehydration by drinking more fluids, but severe dehydration needs immediate medical treatment. Moving on to the symptoms of dehydration. Thirst isn't always a reliable early indicator of the body's need for water. Many people, particularly older adults, don't feel thirsty until they are already dehydrated. That's why it is important to increase water intake during hot weather or when you're ill. The signs and symptoms of dehydration also may differ by age. For the symptoms of dehydration for the infant or young child, it includes dry mouth and tongue, no tears when crying, no wet diapers for 3 hours, sunken eyes and cheeks, sunken soft spot on top of skull, and listlessness or irritability. For adult, the symptoms includes extreme thirst, less frequent urination, dark colored urine, fatigue, dizziness, and confusion. Causes of dehydration. Sometimes dehydration occurs for simple reasons. You don't drink enough because you're sick or busy, or because you lack access to safe drinking water when you're traveling, hiking, or camping. Other dehydration causes includes diarrhea, vomiting. Severe acute diarrhea, that is diarrhea that comes on suddenly and violently, can cause a tremendous loss of water and electrolytes in a short amount of time. If you have vomiting along with diarrhea, you lose even more fluids and minerals. Second is fever. In general, the higher your fever, the more dehydrated you may become. The problem worsens if you have a fever in addition to diarrhea and vomiting. Third is the excessive sweating. You lose water when you sweat. If you do vigorous activity and don't replace fluids as you go along, you can become dehydrated. Hot, humid weather increases the amount you sweat and the amount of fluid you lose. And lastly, the increased urination. This may be due to undiagnosed or uncontrolled diabetes. Certain medications, such as diuretics and some blood pressure medications, also can lead to dehydration, generally because they cause you to urinate more. Risk factors of diabetes. Anyone can become dehydrated, but certain people are at greater risk, such as the infants and children. They are the most likely group to experience severe diarrhea and vomiting. Infants and children are especially vulnerable to dehydration. Having a higher surface area to volume area, they also lose a higher proportion of their fluids from a fever, high fever, or burns. Young children often can tell you that they are thirsty, nor can they get a drink for themselves. For older adults, as you age, your body's fluid reserve becomes smaller. Your ability to conserve water is reduced and your thirst sense becomes less acute. These problems are compounded by chronic illnesses such as diabetes and dementia, and by the use of certain medications. Older adults also may have mobility problems that limit their ability to obtain water for themselves. People with chronic illnesses. Having uncontrolled or untreated diabetes puts you at high risk of dehydration. Kidney diseases also increase your risk, as do medications that increase urination. Even having a cold or a sore throat makes you more susceptible to dehydration because you're less likely to feel like eating or drinking when you're sick. For those people who work or exercise outside, when it's hot and humid, your risk of dehydration and heat illness increases. That's because when the air is humid, sweat can't evaporate and cool you as quickly as it normally does, and this can lead to an increased body temperature and the need for more fluids. Complications. Dehydration can lead to serious complications including heat injury. If you don't drink enough fluids when you're exercising vigorously and perspiring heavily, you may end up with a heat injury ranging in severity from mild heat cramps to heat exhaustion or potentially life-threatening heat stroke. Second is the urinary and kidney problems. Prolonged or repeated bouts of dehydration can cause urinary tract infections, kidney stones, and even kidney failure. Seizures. Electrolytes such as potassium and sodium help carry electrical signals from cell to cell. If your electrolytes are out of balance, the normal electrical messages can become mixed up, which can lead to involuntary muscle contractions and sometimes to a loss of consciousness. And lastly, the low blood volume shock or hypovolemic shock. This is one of the most serious and sometimes life-threatening complications of dehydration. It occurs when blood volume causes a drop in blood pressure and a drop in the amount of oxygen in your body. So how can we prevent dehydration? To prevent dehydration, you have to drink plenty of fluids and eat foods high in water such as fruits and vegetables. Letting thirst be your guide is an adequate daily guideline for most healthy people. People may need to take in more fluids if they are experiencing conditions such as vomiting or diarrhea. If your child is vomiting or has diarrhea, start giving extra water or an oral rehydration solution at the first signs of illness. Don't wait until dehydration occurs. The second is strenuous exercise. In general, it's best to start hydrating the day before strenuous exercise. Producing lots of clear dilute urine is a good indication that you're well hydrated. During the activity, replenish fluids at regular intervals and continue drinking water or other fluids after you're finished. Third is hot or cold weather. You need to drink additional water in hot or humid weather to help lower your body temperature and to replace what you lose through sweating. You may also need extra water in cold weather to combat moisture loss from dry air, particularly at higher altitudes. Illness. Older adults most commonly become dehydrated during minor illnesses, such as influenza, bronchitis, or bladder infections. Make sure to drink extra fluids when you're not feeling well. The previous table shows the average daily intake and output of water. So this is the ideal intake of water to avoid dehydration. So indicated from the table as previewed is the intake and its measurement in ml per day, as well as the output and its measurement in terms of ml per day. Intake. First is the oral fluids. The average daily intake in terms of ml for the oral fluids is 1,100 ml to 1,400 ml per day. For its output, it is sensible. The second is the solid foods. The average daily intake in terms of ml is 800 ml to 1,000 ml per day. For its output, it is urine, 1,200 to 1,500 ml per day. Third is the metabolic water 300 or oxidation of food. For the output of the intake, it is intestinal, insensible, lungs or water vapor, or in terms of skin or sweat. The average output of the metabolic water 300 or oxidation of food is 400 ml per day. So the total ml per day to be intake with the fluids mentioned are 2,200 ml to 2,700 ml per day, or approximately 2,500 ml per day. For the output of the previously mentioned fluids or water, the average amount is 2,200 to 2,700 ml per day for its output, or approximately 2,500 ml per day. That is all.